Anytime you're ready.
Hi, I'm Rob Cantrell. Thank you for joining me. I'm a licensed substance abuse counselor in California. I have a master's degree in substance abuse counseling, and currently I'm in a doctoral learning program at California Southern University in psychology. Today I want to talk to you a little bit about co-occurring disorders. And as we go through the slides here, hopefully I'll be able to provide some information to give you a little knowledge on the topic. As we go to the next slide, in 2013, there were 22.7 million Americans in need of substance abuse counseling. Of that huge number, only 11% actually were able to get it. If you stop to think that 2.5 million people spent on average of $60,000 apiece for a 90-day stay in treatment in order to get their lives back together. And for a majority of them, that didn't happen. What we're going to find in the next slide is that with people that have had issues with opiates, 91% relapsed in the first year, methamphetamine, 90%, alcohol, 75%, benzos such as Valium and Xanax, 51%, and then cocaine, which does include crack as well, 41.5%. So, which leads us to wonder, not all treatment programs can possibly be wrong, there's too many of them. There's got to be more to the issue than simply drugs and alcohol. Which leads us to this, what is a co-occurring disorder? Well, we're going to find out a co-occurring disorder is a combination of two things. You've got a person who has at least one mental health disorder and also abuses drugs or alcohol. Under the factor of mental health disorder, you've got bipolar, anxiety, depression, post-traumatic stress disorder, schizophrenia, drugs of abuse, alcohol, opiates, marijuana, cocaine, meth. There's a list of these that are now subcategorized under substance use disorder, which we'll get into. If we go to the next slide, we're going to see that by definition, the DSM-5 has made some changes. The co-occurring disorder is now known as the simultaneous existence of one or more disorders relating to the use of alcohol and or drugs of abuse, as well as one or more mental health disorders. So you've got a combination there. And on the next slide, what we know is that formerly this was called dual diagnosis or dual disorder. A co-occurring disorder describes the presence of two or more disorders at the same time. An example of this would be a person that's suffering with a substance use issue and bipolar problems. Going to the next slide, we've got severity of the co-occurring disorder is broken down into two different levels. You've got the non-severe, which includes mood disorders, anxiety disorders, adjustment disorders, and personality disorders, and that which is labeled severe, which includes schizophrenia, bipolar disorder, schizoaffective disorder, and major depressive disorders. So Hazelton has done a study and found that 75% of clients that have been treated for substance use disorders also had a diagnosable mental health disorder. In the same light, 50% of clients with a mental health disorder at some period of time in their life also had a substance use disorder. Going to the next slide. With this, we're looking at people that have substance use disorders are more likely to live with mood and anxiety disorders, those being listed on the board in front of you. And if you take a look across, the one that is highest on the rating is antisocial personality disorders. We'll get into that in just a bit. And going to the next slide, we're going to see that what the definition of what a mental health disorder actually is. Definition has changed somewhat. The DSM-5 definition now signifies that it's a significant and chronic disturbance with feelings, thinkings, functioning, and or relationships that are not due to drug or alcohol use. And they're not a result of a medical illness. What that does include are the list to the right. social phobias, borderline personality disorders, PTSD, bipolar disorders, major depressive disorders, schizophrenia, obsessive compulsive disorders. These are present with or without the use of drugs. Going to the next slide, we're going to find exactly what is a substance use disorder. Based on the DSM-5's definition, which has now changed from previous definitions, substance use disorders occur when the recurrent use of alcohol and or drugs cause clinically and functionally significant impairment, such as health problems, disability, failure to meet major responsibilities at work, school, and home. A diagnosis of substance use disorder is based on evidence of impaired control, social impairment, risky use, and pharmacological criteria. These are all found in testing. If you look at this, what is co-occurring treatment and how does it differ from the traditional treatment you would find in a substance abuse treatment center? Most treatment centers today follow one of these three models. They're following the motivational enhancement therapy, which is showing people that they need to change. There's a reason to change, there's need to change, good things will happen. Cognitive behavioral therapy, in a nutshell, is telling people that we're going to teach you skills so that you will know how to identify issues in your life, recognize them, and have the skills to keep from making the same mistake. The 12-step facilitation model basically allows patients to utilize group engagement. It also has a spiritual aspect to it. The problem with this, and historically, clients with co-occurring disorders have historically received substance abuse treatment in isolation from their mental health care. Problem with this is that the process simply is not working. If we look at the next slide, we're going to see what's happened historically. You've got a person that has a substance abuse issue, but has been diagnosed with mental health issues, and the professionals are saying, yes, we can help you with your one problem, but you're going to need to go somewhere else and have this other issue taken care of. It's a breakdown. Sorry, you're not going to get that here. Take care of your problem first. Going to the next slide, we're going to see that with an integrated model treatment, there's an approach to treating co-occurring disorders and utilizing one competent treatment team at the same facility, which makes sense. To recognize and address all mental health and substance use disorders at the same time. That being said, the next slide is going to give us more information that the integrated model of care assumes some basic principles that one disorder does not necessarily present itself as the primary problem, that there isn't necessarily a causal relationship between co-occurring disorders and a substance use, and there are co-occurring brain diseases that need to be treated simultaneously if you're going to have success. Now, how is this done? It's done through a series of screening. The first phase of an evaluation is where the potential client is interviewed to determine if he or she is appropriate for that specific treatment facility and determine the possible presence or absence of a substance use or a mental health problem. Next is the assessment. The second phase just simply says that there's an evaluation where a systematic interview is necessary to verify the potential presence of a mental health issue or a substance use disorder detected during the screening process. So what are these two things going to find out? We're going to find out if the person presents highly intoxicated, do we really know what the true issue is? Is a person presenting with withdrawal syndrome? Is this some type of substance-induced disorder? You know, what are the motivational factors? Is this person presenting because his wife's leaving him? Because the court has decided he's going to jail if he doesn't come into treatment, or he wants to keep a job? How does this person feel about being there and the possibility of the disorders that are being presented to him? Next, we're going to find that with this evidence-based practices, the integrated combined therapies are put together. You've got evidence-based practices that are put into one form at one location. Motivational enhancement therapy is first utilized to initiate change and engage the client in the therapeutic process, letting them know why they're there and what can be done for them. Cognitive behavioral therapy is letting the client know that the change is going to come from within, and we're going to show you how to do it. The 12-step facilitation carries the patient or the client past the treatment facility through life. That's the ongoing stage of long-term aftercare. Following with that, there's benefits with using this model. There's the reduced need for coordination between two staffs. The staffs are now combined into one location. There's a reduced frustration with the clients. One group of professionals are saying one thing while the group at another facility is saying something else. There's shared decision-making between everyone involved in this process. Families and significant others are included in the program. There's transparent practices. Everyone knows what's happening. They're all on the same pages. And most importantly, clients feel empowered that they have control over their own treatment. And clients and families have more choices. They can decide what's going to work for them. And if you'll notice on the next slide that the involvement of family that we found has been a huge factor in treatment. It's been a myth that people with co-occurring disorders are disconnected from their families, and that simply isn't true. More times than not, they're highly involved with their families. Research has shown that outcomes for substance use and mental health disorders are improved, including fewer relapses when families are actively engaged in treatment. You know, unfortunately, there is a downside. Family members of a client who has reoccurring disorders often experience considerable stress, heartbreak, and confusion because they don't know what's going on and they don't know what to expect in the process. So dual recovery groups are highly important. These are peer groups that can be found on the internet, and there's no need for me to read these to you. These are available at online. But for anyone that's dealing with co-occurring disorders, these are organizations that will help the person deal through it, and they're all based, most of them, on the 12-step model. Finally, we're going to go and hopefully bring this to a conclusion in the fact that we need to remember that there are many pathways to recovery. You know, recovery is self-directed, and it's empowering, it's involving personal recognition, and there's a need for change, there's a need for transformation. Recovery exists on a consortium of important health and wellness issues. First and foremost, we need to recognize that recovery involves addressing discrimination and transcending shame and stigma, which is a huge issue with anyone with substance abuse issues or with mental health issues. Recovery is supported by peers and with allies, with the involvement of joining and rebuilding your life in the community, and most importantly, recovery is a reality. And we'll find out, lastly, you know, don't cling to a mistake just because you spent a lot of time making it. There's hope and there's recovery for coexisting disorders. Thank you for joining me. I'm Rob Cantrell.